All right. So the curbs on insurers, private equity sought for Medicare pay plan. We're going to go over a lot, y'all. So hopefully you have more than just a few minutes. But if you have a few minutes, this first part is really important for you to understand about what's going on with your Medicare, especially if you have traditional or original Medicare. You know, that red, white, and blue Medicare card that you use at your doctor's offices and your different healthcare facilities like hospitals, and maybe even going to get your dialysis done or other things. If you're listening to this, or if you have a loved one on Medicare, this is extremely important for you to understand that Medicare could be changed overnight. Your primary insurance, your red, white, and blue Medicare card, which is your primary payer of your medical services and supplies, could be changed overnight. All right, here we go. So Democrats say direct contracting model will privatize Medicare. Okay, healthcare industry pushes Biden administration to save it. Health industry officials hope a palette of possible fixes will help save a disputed Medicare pilot program that faces overhaul and elimination by the Biden administration as early as this week. The suggested changes range from limiting the role of private equity and health insurers in the program to revamping how spending targets for care are set. The professional and direct contracting model was designed to help move traditional Medicare away from fee-for-service care. That's right, traditional Medicare away from fee-for-service. That's what traditional Medicare has always been since 1965. So for you folks that have traditional Medicare fee-for-service and you like going to any doctor in the that accepts assignment over 1 million providers, it is literally saying it will change and help move traditional Medicare away from fee-for-service. So note that this is a big change and toward value-based care in which provider reimbursements are paid on patient outcomes and costs. So now the providers that love traditional Medicare as their primary payer because they pay the bills within as early as 21 days, there's policies and laws that are in place to make payment for the medical services and supplies that the providers, your doctors, your OTs, your PTs, deem medically necessary. That personal, intimate relationship that you have is under fire. The model is under fire. Sorry to be redundant here. Is under fire from dozens of congressional Democrats who are pressuring the Biden administration to kill it. In a recent letter to HHS officials, 54 House Democrats said the pilot program is an attempt to privatize Medicare and creates a perverse motive to decrease the quality and volume of seniors' care. All right. So looks like we have 54 advocates here for you Medicare beneficiaries. Okay, healthcare industry groups have mounted a furious push to persuade the administration to fix rather than eliminate the model, which brings physicians groups and team-based care to the fee-for-service Medicare. So they're saying keep fee-for-service because physicians groups have always liked the facility fees, have always liked being able to have that one large payer pay for so many of the Americans that are under the federal or federal state-based coordinated program like Medicare, like Medicaid, and believe over 150 million Americans are in a program that is federally funded. So CMS does a great job of making sure that so many Americans have health care. Okay, so high cost, poor results, waste have been a problem in traditional Medicare, and said Don Crane, President and CEO of America's Physicians Groups. That's pretty accurate. To have the model snatched away by well-intended but misinformed people that want to preserve a highly dysfunctional system who also, with all due respect, are not factually correct with respect to all their allegations, would be one of the greatest shames in American healthcare, Crane said in an interview. All right. Medical organizations known as direct contracting entities. And if you don't know what direct contracting entities is, a very informed and very wise person named Chris Westfall has done a direct contracting entities YouTube video that I suggest you watch if you want to know more about that and what's going on. But this is what's going on for this week with these direct contracting entities. So that participate. So let's read that again. Medical organizations known as direct contracting entities that participate in the model can assume their either 50 or 100% of the risk-adjusted cost of care for beneficiaries. That sounds like privatization to me. I don't know what you guys think, but that sounds like a normal small business that assumes risks for, say, just running a business. Okay, so while sharing in the savings, so this is where the incentive is, and losses accordingly. So that's where the risk is. So if they assume 50% or 100%, they're assuming the risk there, but they're also assuming if they do save the Medicare money, then they would also be rewarded for that. Okay, the model involuntarily places beneficiaries in a Medicare managed care template if their primary doctor is part of a DCE, said Diane Archer, president of Just Care USA. Wow, okay, so yeah, and it is involuntary because you no longer are having the fee-for-service that you signed up for. It would be a DCE, and it'd be what's known as crosswalked, or just passively within one of these DCEs. Especially your doctor, your doctor, physician, or provider may know it, but the beneficiary would not know it until they felt like something changed in their medical services or supplies being paid. So lots of them won't even know what hit them. There is no fix that will make this a meritorious model, and if you don't know what that means, it is a deserving reward or praise. And let me see, that's Archer said. So here we go, adding guardrails, and we're halfway through, y'all, so bear with. Adding guardrails. Crane said the pilot program should be promoted and continued with some important guardrails, like limiting contracting entities to physicians groups only and requiring these groups to have 75% of the board members be participating physicians. Currently, participants in the model can be provider organizations like health systems, primary care practices, clinics, health plans, and other healthcare organizations. So keeping it within the healthcare community is what he's saying. And then according to the Centers for Medicare and Medicaid Services, known as CMS, House Democrats say the contracting entities can also be privately owned by some large health insurance companies and private equity firms. So yeah, now they're allowing the participation from the healthcare community, but also, obviously we all know the insurance companies and private equity firms have a lot of capital to buy into the game as well. Okay, companies participating in the model include One Life Health, Oak Street Health, and Clover Health Investment Corp. And another worthwhile guardrail, according to Crane, preventing parent owners of the contracting entity from exercising too much influence or maybe even any influence on the delivery of care. That's right, more like a conflict of interest. The concept here is that this is to be a program that moves from individual physicians to organized physicians groups. That's kind of good, pretty good in my opinion. Not to anybody else. Private plans, health plans, private equity firms, and other business interests that own direct contracting entities shouldn't be the entity charged with the responsibility of delivering care, Crane said. Yeah, that's right. Shouldn't be the entity charged with the responsibility of delivering care. Yeah. Uh, yeah. So he's saying here that who gets to have control over delivering care. That's correct. Definitely your doctors. Definitely the medical professionals that have devoted their lives to helping patients. Okay, so but to say that as a funding source, they can't be a funder or a lender. Oh my God, we need all the capital we can get to build American healthcare. Crane said. I wonder what he means by that. If you'd actually break that down. So if you're out there, Mr. Crane, if you're listening to this, would love to ask you some more questions, and I'm sure beneficiaries would like to know more. And I'm going to dive deeper into some of his interviews if you guys are interested. Let me know in the comments below if I should dive deeper into the president and CEO of America's Physicians Group, Don Crane, right here. All right, almost finished, y'all, and we'll go over a little bit of what's going on. All right, a fresh look at benchmarks, a product of Trump administration. So this pilot program was designed during the Trump administration. Began operation April 2021 during the pandemic, obviously, but the CMS stopped accepting applications for new organizations interested in participating in 2022. The contracting entities have spending targets, benchmarks based on their patients' prior spending history over several years. They operate much like accountable care organizations. If you don't know about accountable care organizations, I will have a video for you about that. I actually look into many accountable care organizations just to see what the trend is there for these physicians groups and how they're, how the Medicare program saves money. It's the entity that program entity that is designed to save Medicare program money for fee for service, and it's going to say that in a second. So the groups of hospitals, doctors, and other clinicians that also provide coordinated care, not value-based care, but coordinated care in fee-for-service Medicare. Fee-for-service Medicare has a bad rap, but so many doctors, hospitals, and clinicians love how they pay out medical bills and supplies. Beneficiaries love how they have primary insurance by traditional Medicare. Millions and millions of people since 1965 have been on fee-for-service and love it. And so even though it gets a bad rap in the news and like spending, it is a great way for the medical professionals, facilities out there to be paid for their services, because it's very direct. And so direct contracting model is not direct. It has some questions, I should say. All right. So these ACOs also participate in the model. David Pittman, a senior policy advisor at the National Association of ACOs, and so that's currently what's in place as something that's going to coordinate the care and try to save the Medicare program, Medicare A and B, some tax dollars, and save the Medicare program with efficiency with coordinated care for fee-for-service. So when determining benchmarks for the model, and we're talking about fee-for-service here, the CMS put more emphasis on cost of care during the most recent years. Pittman said this disadvantages ACOs because that's typically the lowest cost year for their patients, because ACOs have already been working for several years to reduce care costs. That's correct. There's news article, and just obviously documents out there saying how ACOs save the Medicare program, the fee-for-service Medicare program, valuable tax dollars. Okay, we're trying to get them to flip it, Pittman said, of CMS, and make the most important year have the least influence on the reimbursement and rate setting process for contracting entities. Alrighty. We're trying to get them to flip it. Okay, yeah, they don't like that first year rule. Okay, savings by ACO. So this is a little bit more about ACOs, and we're done, y'all. But the group also wants CMS to factor Medicare savings provided by ACOs into the contracting entity benchmarks for future performance. And that could be good. By correcting some of these things, the CMS would lower the incentives for these new players, which are the butt of political oppositions to be in the model, Pittman said, of contracting entities backed by health insurers and private equity and venture capital firms. Yeah, they want more, the bigger piece of the pie, and they're looking for more profit, right? And so ACOs are typically, are participating. They have skin in the game. With this, he's saying that obviously they would be participating, but they wouldn't necessarily have skin in the game if they're just paying or funding the DCEs, right? Or influencing them. Okay, we're trying to make suggestions that would sort of elevate the participation of provider-led, historically successful ACOs. That's correct, which include hospital systems, health systems, medical practices, and other provider-based entities. So more organizational-based, surrounding the medical community, as opposed to the individual doctor and beneficiary relationship. They're just trying to organize it because there's so many beneficiaries to try to service. I'm getting reports now, and I live in Charleston, South Carolina, that there's waiting for a primary care physician can in some areas, as long as like 4 months, specialists like 6 months to wait to get a one-on-one with them. So we need more people to service the folks that are transitioning into Medicare. There's literally 11,000 Medicare beneficiaries, eligible Medicare beneficiaries per day. Not all of them transition into Medicare, but we need more providers, not just in the populated areas, but more providers helping beneficiaries in the rural areas where they have to travel over an hour or 45 minutes to maybe not just a primary care physician, but specialists, or travel out of state, so and try to get the best care that they choose as Americans. Okay, I went off on a tangent there. So all right, guys, so that's pretty much it right there. I won't read the rest because obviously they're wanting to talk about DCEs and just wanting to have more just wanting to either fix it or get rid of it. But what are you guys' thoughts about direct contracting model? What are you guys' thoughts about private equity and insurers putting more of their influence onto traditional Medicare folks, which are the fee-for-service Medicare folks, which are the fee-for-service providers, and out there that possibly like the fee-for-service, or even have it as a major part of your business as well. So if you have some comments, I would really love to hear from y'all. This is a community of obviously people surrounding your Medicare, which is important to you, especially if you are utilizing it for your different services, medical services and supplies. So let me know what you think. Thanks for listening in, y'all, and please don't forget to hit the like and subscribe button so that way we can pass on this information to more of the Medicare community.